Greetings and welcome once again to our community video update. I'm appreciative of you spending a few minutes to learn more about what's happening throughout our community and especially here at FHN. Currently, the pandemic is still in full effect. In fact, we're seeing record numbers of positive COVID-19 patients. We are at our highest number since the beginning of the pandemic back in March of 2020. At the time of this recording, we have over 30 patients that are positive in our hospital right now. In fact, it's all hands on deck as our staff are working tirelessly to make sure that not only those patients are receiving excellent care, but also the number of patients that we're seeing that require that ongoing care on a normal basis at the hospital. Today, I'm joined by Margie Kochsmeier, who is our expert infection preventionist, and I'm really grateful she was able to spend time with us today because she has been working up on the patient units as well, trying to help out during our workforce crisis and our high patient census. So thanks for making time for us, Margie.
Thank you. Please do your part and help reduce the transmission of the virus that causes COVID-19 by wearing a mask correctly over your nose and mouth. If you haven't been vaccinated, make sure that you take a vaccine. If you have been vaccinated, make sure you get a booster shot. Our vaccines are what helps keep us protected and protects our community.
Well, that's for sure. And please, if you do know a healthcare worker, regardless of whatever their job title is, please give them a word of thanks and encouragement. The work has been especially exhausting both physically and emotionally at this time as we're doing our best to keep up with the demand. We really do appreciate all of the work that's being done day in and day out by our team. So please give them a little bit of extra attention and recognition for helping to keep our community safe and for caring for our families.
The Pfizer vaccine is the only vaccine available right now for the 5 to 11 year age group. This is a lesser vaccine dosage. It's a third less than what an adult dose is. For kids 12 to 16, the Pfizer is the same dose as the adult dose of Pfizer without the booster. There needs to be 21 days between first and second dose. We don't want anybody to take the dose before 21 days. If you go over the 21 days, you have 6 weeks or 42 days to take that second dose. And if for some reason you're in the hospital or you just can't get it in the 42 days, you would never start the series over for Pfizer. You would just take that dose as soon as you could. The dose for booster is full strength. There is no difference in it. For Moderna, this is adults only. There is no children's dose for Moderna. 28 days between the first and the second doses. The booster or third dose is given 6 months, just like Pfizer, after the initial dose. And the booster for Moderna is a half dose. Johnson & Johnson, this is a vaccine for 18 years of age and older. No children's dose on this one. This started as a one-time vaccine, and they are saying now that you can get a booster 2 months after your initial Johnson & Johnson. As we've seen the strains of COVID change or mutate, they've become stronger, and we have seen kids testing positive more now than what we did last year. Vaccinating kids will not only help keep them protected from getting sick, but it's going to help keep them in school for that face-to-face learning that is so important to them. Vaccinating kids can also help reduce community transmission of the virus. There have been children that have died from COVID. So this isn't just a serious illness for adults, but for children as well. Pfizer currently has clinical trials that are started for ages 6 months to 5 years of age. They're hoping by either end of year or early 2022 that there will be something ready for this age group. There is no recommendation right now from Pfizer for children to get that third dose or that booster dose, as a lot of vaccines effectiveness wears off over time, and I expect that we will probably see kids need an annual vaccination for COVID. breakthrough case is when someone gets a disease that they've been vaccinated for. We have seen some breakthrough cases. It's important to know, though, that that doesn't mean that the vaccine isn't working. The majority of the vaccinated patients have not become critically ill. If they have needed to be in the hospital, they have done very well. They haven't had to be ventilated. The majority of the patients that we have seen in the ICUs ventilated and become critically ill have been unvaccinated. Vaccination boosters can help keep you protected, and again, those precautions that we have talked about before are going to help those breakthrough cases. Wearing the mask correctly when you're out in public, it has to cover your nose and your mouth. Using hand sanitizer, using the sanitizer or the wipes as you go into a store, so you want to use that before you enter the store and when you are leaving. Avoid crowded places. Not everyone has symptoms of COVID that can spread it, so transmission can happen 2 days before someone has symptoms. Many cases of breakthrough cases of COVID can be managed at home. If you do have a breakthrough case and you need to be hospitalized, you have a better chance at recovery if you've been vaccinated. Currently, ages 18 and older are eligible for a COVID booster, especially people that are 50 and older, because they have serious illnesses that can occur. You know, once they get sick, they can become sicker. People with underlying medical conditions are at higher risk. People with heart and lung disease, people that have had organ transplant. We've seen people with diabetes and those with body mass indexes greater than 30 that seem to get more sick with COVID. And then, you know, if you work in a high-risk setting, these are all the people that really need to make sure that they're protected. If you've taken Pfizer or Moderna, you should wait 6 months after your second shot to get your booster, and 2 months if you've gotten Johnson & Johnson. If you took your first 2 doses with Pfizer, you can take Moderna for your booster. If you took Moderna for your first 2 doses, you can take Pfizer as your booster. And for Johnson & Johnson, your booster can either be Pfizer or Moderna. Yes, they are. You can visit the FHN.org site to register and schedule your visit, or visit our social media pages where you can get some more information. Every week there's new variant strains that are identified. Most come and go. Some come and stay, some will come and they just stop. The longer a virus circulates, though, know that there is more chance for mutation and more chance for the strain to get stronger. All variants are monitored by variants of concern, variants of interest, and variants of high consequence. The classifications are based on how a variant spreads, whether or not our treatments are working for them, how well our vaccines are working, and we see multiple variants that are different from the first strains that we saw in China. Alpha, beta, gamma, and delta are variants of concern. It's Delta that we have seen that has been circulating most in the United States. A variant of high consequence means that our vaccine is not working, and we have not had any variant strains in that category yet. An increase in the number of cases, though, puts a strain on healthcare and can really lead to more hospitalizations and possible deaths. It's very important to take a flu shot this year. We are already starting to see a lot of cases of RSV, rhinoviruses, and we're also starting to see influenza. And the CDC says that you can take both a COVID and a flu shot at the same time. If you choose to wait, you can wait 2 weeks in between your vaccines, and it will help keep you protected for this season. As we move into our holidays, we're going to see a lot more get-togethers in indoor spaces. And remember that someone could be transmitting COVID or other respiratory viruses without showing outward symptoms. Again, the importance of vaccination is stressed to help protect you so that if you do get one of these viruses, that you will not become critically ill. The virus is spread through respiratory droplets, so when you're talking to somebody or if someone's talking and their droplets land on a table, if you touch those droplets and touch your face, that is how you're going to have it transmitted to you. If you're vaccinated, again, remember to get a booster shot to help keep yourself and others around you protected.
Unfortunately, as we started this video, we talked about the increasing numbers that we've been seeing throughout our community. And we continue with that upward trend, which is very concerning for us for many reasons. And so we're doing all that we can to help keep those numbers down and ask our community members to help us so that we can ensure we're able to care for the number of patients and their families as they're coming in through our doors. So as we see these numbers continue to rise, it certainly is something that's a warning for all of us to be very vigilant in taking care of each other. Even though we're seeing a significant increase in patients, one of the things that this pandemic has allowed us to do with the duration that it's been going on is to develop some effective protocols and plans for us to be able to better manage the day-to-day circumstances. However, our biggest challenge right now is a workforce need, and shortages throughout the workforce have been creating an increased pressure and demands on all of our staff who are working extra shifts and are moving from different areas or different departments to help those departments that are shorter or understaffed. So our protocols have helped us to have good guidelines in place to be able to show how we do our work for those that are working really hard to keep one another safe. As we continue to place a priority on keeping people safe, that includes screening protocols for visitors and also limiting the amount of visitors or amount of time visitors are able to spend with patients. We know that human contact is important, but we also want to make sure that we're not introducing any unnecessary risk into our environment. At the same time, we are using a strict protocol for utilizing our personal protective equipment. We're making sure that we provide safe measures for our staff, such as strongly encouraging vaccination as well as routine testing to ensure that individuals are not bringing COVID into the facility and keeping each other, again, protected as well as protecting our patients. Increased cleaning protocols and guidelines are still in place. We're trying to spread out wherever possible and again do all that we can to help control the spread. At present, we're closely looking at what are the things that we may need to do if we're unable to care for the number of patients that we're currently seeing with this influx. We have not routinely canceled or rescheduled any elective procedures. What happens is that we found during the beginning of the pandemic, when we delay care or we cancel procedures or appointments, what happens is that people's illnesses or chronic conditions only get worse if untreated or not available for care over time. Oftentimes with elective procedures, people are getting procedures done to help alleviate some suffering or some pain, and so we don't want to disrupt that or prolong any unnecessary hardship for patients, both from a physical standpoint, financial standpoint, and as well as an emotional standpoint of wanting to get diagnoses, get treatment, and get back to activities of daily life the best they can. As we look at each case on a daily basis, if we feel there was ever a risk or a concern to being able to give that patient the best safe care possible, we would contact them and reschedule them for a later time. But at present, we are still moving forward and encourage people to get their elective procedures, their routine screenings done, as well as any follow-up appointments that they need to get completed before the end of the year. as we enter the holiday season, it's always a time for fellowship and camaraderie and enjoying each other's company. We can still do that and just encourage people to do that safely by paying attention to the size of gatherings, as well as making sure that if you're not feeling well, staying home. Don't be hesitant about not showing up at a party or a gathering if you're not feeling 100%, and remembering it's about other people, not just yourself. Trying to be sensitive to others if they're unable to attend. How do we still include them in the celebrations and let them know that they're loved, they're cared for, and that their company is missed, but they're not out of mind. Again, making it okay not to feel pressure to go to events that you don't feel comfortable going to. And making sure when you do go to those events, you do so safely. Taking care of yourself and others should be the first and foremost priority. Yet at the same time, making sure that you are enjoying the season and not living in a case of isolation. In fact, it is a great time to be connected, even more so with the colder weather upon us. It brings us closer together, and we can do so safely and responsibly. Some of the things that we've done here at FHN as we enter into the holiday season is just look at how we can do the holidays a little bit differently by creating some of that distancing, keeping safe protocols in mind. Things like our virtual FHN bingo night, our Festival of Trees activities goes throughout the entire season. We did a very safe outdoor lighting of our holiday tree, which was really well attended and enjoyed by many individuals. We also have the Festival of Trees displays at the Freeport Public Library. Making sure that we're allowing distance and not crowding around those events allows it to be done safely, and encouraging people to enjoy a movie with us at our FHN movie series that we do throughout the holiday seasons. So we can still continue to have a good time, enjoy many of our normal activities. We're just going to do so as safely as possible by making some slight modifications. I think lastly what I would do is begin or end how I began, which was really to thank healthcare workers, to thank all of the people that are putting in a lot of extra time and effort to make sure that others can enjoy this holiday season. So again, be safe. Thank you for choosing FHN. It's always a privilege to be able to care for you and your families.